Welcome back once again. The Medical University of South Carolina Hollings Cancer Center is constantly working towards technology upgrades and clinical trials for their patients. Dr. David Marshall is a radiation oncologist at the MUSC, and he joins us today to talk about some recent advances that you folks have brought in over the years. And of course, you guys all together do a wonderful job to begin with. And you have the different locations, not only downtown, but also in the Mount Pleasant area. And tell us about some of the new equipment that has come into MUSC Hollings Cancer Center.
So over the last year, we've had the opportunity to make a large investment in a major upgrade in our equipment. We're able to provide folks in the Lowcountry with the latest technology in radiation treatment devices and linear accelerators. We've got a device that we went online with downtown in August at TrueBeam STX, which is the latest technology available to deliver radiation therapy in a number of ways to be most effective at treating the cancer and minimizing toxicity and side effects for the patient.
Tell us about the linear part that you were talking about.
Linear accelerators are a very high technology machine used to deliver X-rays or electrons to treat radiation or to treat tumors with radiation that may be on the surface, but also may be deep in the patient, such as prostate cancer or brain tumors. The technology that we have brought online, the TrueBeam technology, allows us to do all the types of external beam radiation therapy, including highly focused treatments called radiosurgery that allow us to treat with pinpoint accuracy in the brain or also in other parts of the body. So we're very happy to have this latest technology available downtown and now also in Mount Pleasant.
So the way I'm interpreting this is this is machinery that is very precise, exactly precise on where it needs to take care of that cancer area.
Correct. So the idea is to treat the cancer but minimize the radiation dose to the normal tissue. And these types of technologies that we have available help us to do that.
Tell us about the TrueBeam STX that you were getting into
So
as well.
that's the linear accelerator. It's the type of machine that we purchased. We have one downtown, and we also have a new machine, another variant TrueBeam machine going in right here in Mount Pleasant. And we're excited about that too. That goes online, starting to treat patients next week here in Mount Pleasant.
Now the TrueBeam machine, explain a little bit more about what that is.
That is the linear accelerator device itself that allows us to deliver these various types of radiation therapy treatments with very high precision and accuracy. So we can do the radiosurgery where we do 1 to 5 treatments to complete the total treatment package for brain tumors or areas other places in the body. And it allows us to do so with extreme precision and accuracy.
Tell us also about some clinical trials that's taking place at the Medical University.
Well, we have over 300 active clinical trials at the Hollings Cancer Center. We have 200 that are actively accruing patients right now. We have some very exciting things going on. We have, for example, the Southwest Oncology Group lung map trial, which takes the genome of the tumor in each individual patient enrolled on the trial.
In the lungs?
For lung cancers, and types their tumor to the best treatment that we have available on that trial. So we're able to individualize treatment for those patients very specifically based on the biomarkers of their own tumor.
Wow. And when all of this, the x-rays and everything, and you see the tumor, you see what's going on in the tumor, you super smart doctors is what I like to call you, because we put our lives into your hands.
Absolutely.
And whenever y'all are looking at this, y'all get together as a group. And it's not just one decision maker. Sometimes it's a number of decisions.
It's a multidisciplinary team. That's exactly right. So one of the things that I take great pride in is multidisciplinary care. And I think that that's the best way to treat cancer. So in other words, you don't just have the radiation oncologist like myself saying radiation is the best way to treat your tumor. You've got the surgeons, the medical, the chemotherapy doctors all putting their heads together and coming up with the recommendation for the best way. Nutritionists, psychologists to treat the whole patient. The idea is that you have the whole team providing input on the best way to take care of that particular patient's situation.
A lot of cancers come into Hollings Cancer Center.
That's correct.
You folks look at a lot of different treatments throughout the year. What is probably one of the most prevalent cancers that come in?
Lung cancer, breast cancer, prostate cancer. those are the top cancers that we have.
Yeah.
So they're mostly cancers in South Carolina are linked to tobacco, frankly. So tobacco cessation is another service that we are strongly behind and provide at the Hollings Cancer Center.
And a fellow friend of mine in the upstate the other day, he just in his 40s got a physical, everything came out fine, but he said to a lot of his friends on Facebook, get your physicals, whatever the doctor prescribes, if it's yearly, if it's every 5 years or whatever, and if cancers are there, they can be detected so much easier, and it makes your job much easier, and it makes your job much easier to explain to the patient that we caught it very early, everything's going to be fine.
Right, so you're much more likely to be cured or effectively treated if you catch the cancer early, and the best way to do that is with your physician on a regular basis, just as you said.
Wow, you guys are just continue to expand so much at the Medical University Hollings Cancer Center, continuing to do so much, and giving a great healthy and bringing those folks that are sick back to wellness, that's for sure.
Well, that's our goal. You know, we want to provide prevention of cancer and treatment and cure of cancer in the Lowcountry and increase those good outcomes throughout the state.
Doctor, appreciate it. Thank you so much
Thank
for
you very
joining us
much. I
today.
appreciate it.
That. We've got more coming up after the break, so stay with us.